At UNC Health, our mission is to improve the health and well-being of North Carolinians and the communities we serve. Every day, we're leading the way with innovative care, and we empower each other to make a difference. We believe we're better together, and it's a privilege to care for our patients. One of the ways we're working to improve your health is through our Epilepsy Monitoring Unit, or EMU. UNC Health's EMU is a National Association of Epilepsy Centers accredited Level 4 Epilepsy Center, their highest designation. As a Level 4 Epilepsy Center, we use state-of-the-art technology to help monitor your brain activity, including video cameras, microphones, and continuous EEG recordings. These tools give us valuable insight into the source of your seizures and help us create a personalized plan to improve your quality of life. The UNC EMU first opened in 1984 and has since provided the highest quality of care for patients with epilepsy, seizures, or unexplained spells. We monitor over 1,200 EEG sessions each year to better understand your condition and guide your care. We congratulate you for taking the next step in managing your seizures. When you come to the EMU, our goal is to learn more about your seizures and adjust your medication or diagnose your condition more effectively, all while keeping you safe. Your length of stay will depend on how long it takes to record your seizures. Plan to spend about 4 to 5 days in the hospital, but your stay may be a little longer or shorter, depending on the length of time it takes for you to have a seizure and how many seizures the team needs to review to make the best treatment decisions for you. Expect a call from our social worker a few days before admission to see if you need any resources such as transportation or lodging. Hospital staff will get a prior authorization before your admission. You'll want to check with your insurance coverage to understand any out-of-pocket expenses you may have. You are welcome to reach out to our financial navigators for assistance. To help prepare for your stay, you may want to bring clothes that make you comfortable, like pants, shorts, or sweatpants. If you have a sleep preference, you may want to bring your favorite pillow or blanket. You will spend almost all of your time in bed, so you'll want to bring things to pass the time, like books, games, or your laptop. And don't forget your toiletries, slippers, and chargers for electronics. Feel free to bring any work that needs to be done or anything that may help cause a seizure. You'll also need to bring your prescription medications and list of over-the-counter medications and supplements you're taking. Make sure to take your medication as prescribed on the day of the admission. Please don't hesitate to contact us with any questions or concerns. We're here to support you every step of the way. The EMU is located in the Acute Neurosciences Unit on 8 Bed Tower at 101 Manning Drive in Chapel Hill, North Carolina. On the day of your appointment, you will receive a call from the advanced practice provider letting you know what time to arrive, typically in the afternoon or early evening. When you arrive, park in the Dogwood parking deck located across the street from the hospital. You can head over to the Women's Hospital Information Desk by taking one of the Skyways. Once at the information desk, they will verify your appointment and give you a map of the hospital campus. Next, you will take a ticket from the kiosk in the registration area. Once your number is assigned to a registration clerk, they will get you checked into the visit. Remember to bring your health insurance card and photo ID, like your driver's license or state ID card. A registration clerk will complete a proper identification check, print patient labels, and place an ID band on your wrist. Once you are all checked in, you will be directed to the EMU. When you arrive in the EMU, you will be greeted by a nurse or nursing assistant that will help get you settled in. For your safety, the nurse will start an IV saline lock just in case we need to administer medications to stop a seizure. Your IV site, vital signs, and assessment will be checked throughout the day and night. Your nurse will enter and verify home medications with you, prescribed and over the counter, so we can keep track for your health and safety. You'll have EEG electrodes placed for continuous monitoring. The electrodes will be glued to your head and will be removed before discharge. We ask that you wash your hair before admission and avoid using products like gel, mousse, or hairspray so the electrodes stay in place. If you have braids or dreadlocks, we ask that you have your hair unbraided for admission. Please leave any hair dryers or electric razors at home. It's best to bring shirts that open in the front or back so they can be removed without disturbing the EEG electrodes. Don't worry if you don't have shirts that open in the front or back. We will provide a hospital gown for you to wear. Your safety is our top priority. We'll continuously monitor you, including your EEG tracing, heart rate, and oxygen levels, and take steps to ensure you're comfortable and secure. Your bed will include an alarm and padded rails for your safety. A nurse will assist you to the restroom. Although we would like you to experience seizures while in the EMU, we want to ensure your safety. Therefore, you will not be permitted to move around the room freely or leave the unit during your stay. UNC Hospital and all campuses are smoke, tobacco, and vape free. If you need nicotine replacement or nicotine cessation resources, please let your team know. All rooms are private and include your own restroom. We ask that a friend or family member over the age of 18 stay with you to help identify seizure activity. They will have a hospital chair to sleep in. Your meals are included in your stay, and your family member can purchase meals for themselves separately. You are welcome to bring snacks that do not need to be refrigerated or frozen. If you do not have anyone to stay with you, please let us know, and we can request a telesitter that can help monitor you. A video camera with a microphone is in the ceiling to allow us to see and hear what is happening during an event. During your stay, you'll be actively involved in your care. You'll have a button to press when you or a family member notice the sign of a seizure. This helps our team respond quickly and ask you questions, obtain vital signs, and a blood sugar level. We ask that you and your friend or family member try to remember to describe out loud what you're feeling or experiencing during a seizure to help us create the most effective treatment plan for you. Your care will be managed by a board-certified neurologist with special training in epilepsy called an epileptologist. Other members of the team include fellows, residents, nurses, patient care assistants, EEG technicians, neurodiagnostic assistants, and advanced practice providers, each trained to provide expert care for epilepsy and seizures. The team will monitor you closely during your stay, in person and virtually, through the camera and microphone. Some techniques we use to trigger a seizure include limiting the amount of time you sleep, shining lights in your eyes, or having you do some deep breathing. Often, we will reduce your medication to help trigger a seizure. Keep in mind, we may not find anything right away. If that happens, we'll talk to you about the next steps to find the right treatment. Once your admission is complete, your care team will review findings, including if you need any additional testing and which treatment options are best for you. If it is determined that you are a candidate for surgery, your case will be presented at our multidisciplinary meeting with fellow epileptologists, neurosurgeons, neuroradiologists, neuropsychologists, and neuropsychiatrists. Our epilepsy surgical program nurse coordinator will be in touch to discuss any additional testing and appointments. Thank you for choosing UNC Health. We're excited to partner with you in managing your care, and we look forward to helping you on your journey to better health. If you need assistance, please call us at 984-215-2072. Together, we'll make a difference.